Is single-payer healthcare socialized medicine? Have you ever wondered about the differences between single-payer healthcare and socialized medicine? This topic is important as it affects how we think about healthcare systems around the world. Let's break it down. Single-payer healthcare is a system where one public authority, usually the government, pays for healthcare costs for everyone. Instead of having many private insurance companies, there is just one public entity that collects funds, often through taxes. This means that all residents receive healthcare coverage without worrying about different insurance plans. Now, the delivery of care in single-payer systems can happen through private or public providers. For example, in Canada, the government finances healthcare, but most services are provided by private doctors and hospitals. This setup allows for a mix of public funding and private delivery, which can simplify administration and reduce costs. On the other hand, socialized medicine goes a step further. In this system, the government not only pays for healthcare but also owns and operates healthcare facilities. This means that the government employs healthcare professionals and manages hospitals and clinics directly. The British National Health Service, or NHS, is a classic example of socialized medicine, where the government controls both funding and the provision of care. From a socialism perspective, the key difference lies in ownership and control. Socialism advocates for collective ownership of the means of production. When applied to healthcare, this means the government should own and operate healthcare facilities. Single-payer healthcare, while publicly financed, does not necessarily involve government ownership of healthcare delivery. Therefore, it is not fully socialized medicine. In practice, single-payer systems can lead to universal coverage and reduce private profit in healthcare. They simplify the administration by eliminating multiple private insurers, which can lower overhead costs. Socialized medicine centralizes both financing and provision, allowing for more direct government control over resources and planning. However, this requires the government to manage all aspects of healthcare delivery. In summary, single-payer healthcare ensures everyone has access to healthcare but does not mean the government owns or runs healthcare facilities. Socialized medicine involves both public funding and government ownership of services. While single-payer healthcare is a significant reform toward universal access, it may still rely on private sector involvement in delivering care. Understanding these differences can help clarify how various healthcare systems operate around the world.